Hi, everyone. Welcome. I'm Angela Love-Zaranka, Program Director at Lactation Education Resources, and I am here with Sekeita.
Hello, everyone. Good morning, afternoon, evening, wherever you are. I am Sekeita Lewis-Johnson. I am the Accredited Provider Program Director and one of the instructors for Lactation Education Resources. Welcome and thank you for joining us.
Yes, thanks for joining us today. Our conversation today is about real talk, the realities of being and becoming an IBCLC. So a little bit of background about us. I am a board certified lactation consultant. I have been board certified for many years. I started out as a peer supporter, and I have worked in private practice. I've worked in the community. I've worked in a hospital setting. So I've worked in a variety of different locations and settings in advocacy, doing the work and doing the advocacy around the globe. How about you, Sekeita?
Yes, thank you, Angela. I am a board certified family nurse practitioner. I'm an IBCLC. I bring you experience from as a labor and delivery nurse all the way through the trenches of becoming a lactation consultant and teaching in hospital as a clinical instructor, as well as working in the hospital as a lactation consultant and working and serving my community as a lactation consultant.
Yes, so between us, we have a lot of years of experience, and we want to break it down for you for how you too can become an IBCLC. So just a little bit of housekeeping at first. If you'd like to ask questions, it's relatively easy on the GoToWebinar platform. Take a look at this blue arrow, and it's pointing to the question area in the interface. If you're on a desktop, this is what it looks like. If, though, you are listening on your mobile device, then take a look at the green arrow, and it's pointing down to the question mark where you can actually ask questions or you can chat, and you'll be chatting with us. So just to sort of test it out a little bit, if you'd like, please go ahead and provide us with the location where you're participating today. We always love to see where in the world everyone is located. Now we've got some extra people here to support us who are not on camera. Julie Grimes is here. Julie is one of our instructors, is a board certified lactation consultant, and is a member of our amazing customer support team. So she is monitoring the chat. She'll answer some questions there, and she will also flag a few for us to answer at the end of the webinar. Another person on our call today from our phenomenal tech team is Jill, and Jill is here to answer any tech questions which you may have and to make sure that things run smoothly. So if you have any questions, feel free to pop them into the chat and Jill will respond. All right, so let's keep going here and take a closer look at what it means to be a lactation consultant and how you can follow your passion and become one. Now, if you decide to become board certified, you'll be one of over 37,000 IBCLCs in over 131 countries and territories around the world. Credentialing as a lactation consultant is offered by the International Board of Lactation Consultant Examiner Commission. Take a look at their website, ibclc-commission.org. They have different regional offices depending on where in the world you work or reside. Review the requirements and pathways to become eligible to take the IBCLC certification exam. What do you need to know? The detailed content outline or exam blueprint is based on a survey of IBCLCs in various practice settings around the world. Our courses covers the entire detailed content outline, and our courses are approved by LARC. That's the Lactation Education Accreditation and Approval Review Committee. They evaluate and approve lactation consultant training courses. Now, Sekeita is going to review a few questions to ask yourself today as you're listening in. Sekeita, go ahead.
Yes, thank you, Angela. So before we get started and before we take a deeper dive into what the realities are and how all the pathways come together, please keep at the forefront some of these two questions. And it might be helpful for you to write them down, maybe, maybe not, but these are more reflection questions, if you will. We're going to talk about some skills today. And I think it's important for you to really ask yourself, do I have the skills necessary to become an IBCLC? Some people may already have those skills, right? we're going to talk about skills. We're going to talk about skills in a way that maybe you've not always thought of as skills, but I'll break it down for you. So ask yourself, if I don't have the skills, where can I get these skills? After today, try to process these questions so you can develop a plan to get the skills that are necessary for success. Hopefully, we're going to help you make sense of it. So don't worry if it doesn't make sense today. Sometimes you need to hear this a few times, so it will be recorded. But just keep in mind, these are the questions that you want to keep at the forefront of your mind. And I do want to speak to my nurses and my people that are already in healthcare field who already are like, oh, I have all the skills. And I'm going to say, hold up a minute until you see the rest of this presentation and then decide. So what makes an IBCLC? Let's just hop on in. And I do want to say, this is the realities of becoming, the realness. And so we do keep it real in this conversation here. So competency, right? Competency is critical. It means that you have the ability, the skills, the knowledge, and the attitude to complete a task to its fullest and its best successful outcomes, right? You're trying to get a successful outcome. So in any new profession, there's always growth from novice to experts. And so when I made the comment about nurses in the room or healthcare providers in the room, a lot of us may have become experts in other areas, but when you become a lactation consultant, you are still a novice in that area. So novice means I have the foundational knowledge and some skills, right? But I don't have the overall, I haven't been there, done that. I haven't had over 1,000 different cases with 1,000 different outcomes, right? That's drastic, I know, but follow me here. So to speak of as an expert in the field, you really have to be able to have a little bit more clinical experience more than the theoretical experience, right? So it's really bridging the theoretical things that you learn in your courses, in your classes, in your clinicals to actually real life practice. So what's most important is that by the end of your training, you want to be confident that you are competent in your foundational knowledge and this in your skill set. And this ultimately decreases the risk of doing harm to families. Culturally appropriate and credible. If you've worked in healthcare or been around anyone or even in business sectors, you may have heard the word culturally competent. Culturally appropriate is another word. And it could be arguably a little bit more fitting, than competent, and being culturally appropriate means really starting and delivering care with cultural humility. Cultural humility is a lifelong process, and it's a lifelong process where we're learning about ourselves and we're self-critiquing what our own values are. We're not only just learning about other people's cultures, but it starts with an examination of our own belief in our own cultural activities or identities. And it's a lifelong process. It's a process of sometimes unlearning and relearning. And when I say that, some of the things that we learn are built on stereotypes and prejudices. And sometimes we have to unlearn those things. So for example, you may have heard a colleague, or I'm going to say, let me speak in I have heard one of my colleagues say something, and it's not in their culture to do X, Y, and Z. And I had to do a double take because I was like, what? Like, what do you mean? So we want to avoid saying things like that. And most importantly, when you hear someone say something like that, really be able to unpack and really make some gentle corrections, because really and truly, we don't know what a person's culture is unless they have told us, because there are subcultures within cultures. So the first part of cultural humility is not feeding into stereotypes, not making assumptions about what someone will or won't do based on their culture, because you really don't know. Credibility. Are you a credible resource? When you're asked something and you don't know the answer, how do you respond? Do you try to answer off of your lived experience, or do you try to answer off what the evidence says? That's the big difference in being a professional IBCLC. And I'm asking that question because almost everyone wants to tell you their breastfeeding or chest feeding story, right? They're like, oh, it didn't hurt. Oh, I did this and this worked. Or I drank blue Gatorade and I made more milk. Seriously, that's something that people say, which is like, whoa, wait a minute, right? So you can always reflect on your experience, but as a clinician, you want to rely on the evidence. So being a credible resource means you are giving out information that A, coincides with the best evidence, and B, you really know what you're talking about. The question then becomes, do you know what the evidence says? And if you don't, do you know where to go find it? We're not all walking computers or dictionaries. It's impossible to know everything. Demonstrating credibility is about being forthcoming. It's about saying, I'm not so quite sure about that, or let me get back to you. And then check the resources and get back to the client or patient in a timely manner. The issue with credibility, and I see this a lot across the field, is if you lose credibility as a lactation consultant or lactation supporter, it could translate to other IBCLCs losing credibility. It could translate to the profession of IBCLCs losing credibility. So you really want to be a credible person when it comes to giving evidence and supporting families. Policy advisor and creator. So a couple of other things we do as IBCLCs is we advise on policies. We actually help create policies. And that's important to know from a standpoint of talking about clinical care, but also talking about being in the room as a stakeholder, as someone who is supporting families. If policy is not your strong suit, don't worry about that, right? There are some people in this space that probably have taken policy courses and you know exactly what I'm talking about. And you're probably like, yes, I got that skill. That's okay. We need everyone, because language and policies is extremely important, and the creation of those policies are important to the end results and outcomes. Language and policies matter because a poorly written policy can end up with unintended negative consequences. So if you're a policy person and that's your thing, you already have that piece of it, that's okay. Stakeholders, come on, we're all stakeholders. So we should be at the table whenever lactation specific or related policies are being discussed. So if it's not your strong suit, don't worry about it. Just know you need to know how policies are created and how they impact you, or how they impact us, or how they impact the families that you serve, because then that informs your advocacy. Advocacy is big. It's the biggest part of what we do. Well, one of the biggest parts of what we do and who we are. Being an advocate is simply a person who publicly supports or recommends a particular cause or policy. So even if you're not a policy advisor, you can still be at the table listening and sharing your perspective. Problem solving and researching. Problem solving is about 90% of what we do, because every single family has their own set of concerns. A latch concern for one family may be different from a latch concern of another family's. And so when we're called for support, it's usually in request to some type of problem or issue that the family is having. So be mindful of framing lactation concerns from a one-size-fits-all framework. Know that one size never fits all, particularly in lactation land. We really want to be problem solving from an individualized lens of that particular family and the concerns that they're sharing with you. Along with being a problem solver, there's times when you have to go back and you have to research and you have to look that up and you have to say, okay, I don't know what this is, but let me look this up. Well, that's being a researcher, right? But there's two ways to be a researcher. You can be the researcher who carries out academic or scientific research. And trust me, as the field is growing, as the knowledge is growing, we definitely need scientific researchers. But you can also be that person whose job it involves to discover things or verify information. And that is all of us again. Let's remember, we're not walking around as like with dictionaries in our head Some of us do have what they call like photogenic memories. I don't, but we have to rely on valid tools that inform our practice. High-level lactation care and skilled high-level lactation care go hand in hand. When we talk about high-level lactation care, that is truly what sets us apart as IBCLCs. There's, again, I talked about novice to expert. I'm going to give you some examples of basic breastfeeding care, which is assisting with latch positioning when there's no other issues other than I just need a little bit of support. I need the baby's position to be just so the baby can attach properly, right? Versus someone who's in the ICU, a parent that's in the ICU, or a baby that's in the NICU. Those are higher acuity cases which require a higher level of functioning, a higher level of support, a unique level of support. So are you able to look at this case and say, whoa, this is different. This requires that critical thinking, that application of the knowledge that I have, that bridging of theory to clinical practice. And are you able to support them? For example, are you able to support someone with a brain injury that may impact lactation? And do you understand how a brain injury may impact lactation, right? Are you able to make those connections? And I'm asking that because I know in some of the science courses, folks are like, well, why do I need to know about the cranial nerves? And why do I need to know about the brain? For this reason, right? Different lactation challenges present itself, and it's not always from the framework of immediately postpartum or immediately after delivery, right? So when you're doing your training, be cognizant of that. Being able to handle complex clinical cases with sound clinical decision-making and recommendations that are appropriate for higher acuity levels of care is what we're tasked with. So we talk about acuities, and that is the level of care that really is necessary for the optimal outcomes. Do you have the skills necessary? And I'm going to tell you, some people in the room may not, because I just gave you like the worst of some cases, like a brain injury, like what? Somebody intubated, like what? The expectation is that you're not going into the clinical decision-making or into the clinical field or into IBCLC land thinking, I've seen it all. However, once you build your skills, continue to build your skills and continue to build your skills in conjunction with knowing enough to say, well, that's not in my knowledge set, but let me go figure it out. And then you will develop into the expert mode. Essential and timely care. One of the things that we found out or that we heard constantly during the pandemic, the COVID-19 pandemic, was essential. Essential. Were you an essential worker? That became a buzzword. And we found out that yes, lactation consultants are essential because babies still need to eat. People will still continue to have children during any pandemic or catastrophe, and especially during a pandemic. Promoting and protecting the ability to provide human milk is critically important, not just from bonding, but also from a food security standpoint, from a public health and prevention standpoint. So yes, we are essential, and it's important that we show up when families need us, that we are timely, that we can't say to folks, nope, we're in a pandemic now, so I don't know when it's gonna be over, you're on your own, call me, understand we are frontline workers. And so I want to make that really clear because we do talk about telehealth, and telehealth is booming, and telehealth is great. And it is great for some cases in lactation, but it's not the end all to be all, and we can miss some things. Telehealth sometimes can prohibit the ability to use our other senses. And so I want to just be clear that when I say we're timely, we are really showing up in a way that minimizes premature weaning, that minimizes the impact of a family being able to, or the events of a family being able to protect and promote their milk supply and their feeding goals. So it's really our prudent duty to show up so that we minimize harms caused to families, that we are accessible, because that's what becoming an IBCLC is all about. It's about being able to provide accessible care at the time that it is needed, not 2 weeks later when that relationship probably has gone south. Collaborative care partner, a trusted collaborative care partner, is a phrase that I really love because it assumes that you're collaborating with your patient or your client. It basically says you are not the center, you are not the decision maker, you are collaborating. And we use a lot of buzzwords, and this one I always say it can be operationalized so well if you do it with intention. So remember, it's the families and their partners, their goals, their fears, their barriers. They take precedence over any goals that you may have for them. So, you know, we talk a lot about exclusive breastfeeding for the first 6 months, and we know those things and we teach those things, and that's what we should be. We should be, because that's optimal feeding, right? And it's important that we still honor and we still talk about them. However, we also have to understand that we are collaborating in partnership, in agreement, that when someone seeks our care, that they are seeking our care and that we don't overstep boundaries that are not meant for us to overstep. And that's how we become trusted. That's how we become trusted to do no harm, to be reliable. We're trusted to see, I see you as a person. I see that we're in this together. I'm not higher than you. I'm not coming in here like I'm the expert. I'm here and you're there. We're collaborating to do what's best for you. When you go into certain clinical situations and you assume a hierarchy, like, yep, I'm the expert, I know all this, I've been teaching breastfeeding, chest feeding 15, 20 years, I'm gonna tell you how it works. You do this, you do that, you're gonna lose trust. You're gonna lose trust, no doubt. When you go in and touch someone without asking permission, and you know, they said they want latch assistance, and you just go in and you just assume the type of latch assistance that they want. You wanna ask. That's how you become trusted. You're collaborating. You're there as their collaborative person. Person-centered care. Wow. So you've heard me talk about care. You've heard me talk about collaboration. You've heard me talk about communication. You've heard me talk about culture. And the person is the center of it. The Institute of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that the patient values guide all clinical decisions. So when we think about the type of care you deliver and how communication works, the person is at the center. If you want more information about this, you can really look it up. The one thing I will say is person-centered care has also become a buzzword. Don't let it become a buzzword for you. Really practice what this model looks like, and that will further build trust with you, your community, and not just your community, but also other clinicians that you work with. Other clinicians around you will begin to trust you because you operate in a principle that is designed to center the clients as the expert of their care and their health. So I began with some questions. I'm going to leave you with some questions before I turn over to Angela. She's going to begin to speak about the pathways. What you want to start to think about is what pathway is applicable for you. And I always kind of caution people is to listen to the pathways first before you start like thinking about, okay, this is my pathway, that's my pathway, because there's some nuggets that Angela drops that are so extremely important to what your end goals are, right? Also think about the local market. What is the market like around you? Is your area saturated with IBCLCs? No, already I'm going to say no, right? But think about where are IBCLCs working? Are they working primarily in private practice, in hospital settings, in local community centers, in birthing centers? Think about that. Also think about how does the study, how does the course life, how does the clinical hours fit in with your lifestyle? How does it fit in with, you know, all the things that you have to do? And these are also reflective questions that will also help you to be successful along your journey. So I'll turn it over to Angela. Thank you so much for listening.
Thanks, Sekeita. Okay, so as you're asking those questions now, we're going to talk about the actual pathways. So it can feel a little bit complicated. There's a lot of steps here, but we're going to show you and give you a bit of a roadmap to become the IBCLC and break down those bigger steps into smaller pieces. So know that you don't have to go out and find each one of these different components. LER has ways to help you every step of the process. So first, you're going to choose a pathway. We're going to come back to this in just a minute. Now, each pathway has 3 components. The first one is education. The second one is clinical hours. And the third is getting ready for the exam. Okay, first, education. There are 2 aspects to the education. One is health sciences education. Now, these are typical classes or education for healthcare providers. There are 8 post-secondary or university level courses and 6 general education subjects. You can find a full list for each of the 14 subjects on the IBCLC Commission's website. You can search for it or find the link in your resource document. The GoToWebinar interface has a spot for handouts next to the question box. Now, the 8 university level courses, and you don't need to write these down now, are biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally, sociology or cultural sensitivity or cultural anthropology. They can be online or in person as long as the institution is accredited to provide the learning. Now, if you took any of these courses during your college career, they count, even if that was 20 years ago. LER partners with Walden University to provide the basic courses. Walden is online and they have chosen the courses that best fit the Commission's requirements. We are collaborating with Walden to provide our students with deep discounts for the college courses. You can find the link to Walden on our website. Start with the training options banner listing and then click on I want to be an IBCLC. Click on education and you'll find the link there. Now, the 6 general education subjects are medical documentation, medical terminology, occupational safety and security for health professionals, professional ethics, universal safety precautions and infection control, and basic life support. So 5 of the 6 general ed courses can be taken through LER. The only one you'll need to search for is basic life support. In many countries, there is an in-person skills check for this training. I have heard of some organizations providing this training completely online, so it's important to check with your local resources. Now, the guide from the Commission provides general descriptions for typical courses in this subject area. Please keep in mind that the IBCLC is international. The names used in their document to describe the courses may not exactly fit the description of the course at your accredited educational institution. That's okay. You'll note these broad terms with the understanding that there is no one universal description for what a course in, say, clinical research is going to cover. So why are these 14 courses required? The IBCLC is a standalone credential, meaning you do not need another certification, degree, or license to practice as an IBCLC. Once you pass the exam, you will be an allied health professional. The courses will help you to prepare for your career as well as to help you pass the exam. The second is lactation-specific education. This is where we have you covered. The education should be comprehensive and cover the entire detailed content outline. Now, the Commission requires at least 90 hours of lactation education, 5 hours on communication skills, and our 5-hour course is specific to lactation and breastfeeding care and to help you in your practice as a lactation consultant. Our 2-hour course on the International Code of the Marketing of Breast Milk Substitutes, also known as the WHO code, is updated and relevant to your work as an IBCLC. Now, the third component is lactation-specific clinical experience. This can include in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding families. It also includes lactation assistance to pregnant and breastfeeding clients and lactation education to families and/or professionals. These hours are to be obtained within the 5 years immediately prior to applying for the exam. So, how many clinical hours do you need? Well, that depends on your pathway. So pathway 1 is for health professionals and those who provide breastfeeding support through an IBCLC recognized breastfeeding support counselor organization. Now, health professionals, according to IBCLC, includes physicians, nurses, midwives, dietitians, physical therapists or physiotherapists, speech pathologists or speech and language therapists, and others. Breastfeeding support counselors include those accredited through organizations such as LER and La Leche League International or the Australian Breastfeeding Association. Now, Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both the didactic and clinical components, and they require 300 clinically supervised hours working with breastfeeding families. Now, Pathway 3 is a structured mentorship program between an IBCLC and the applicant. So the IBCLC, or if there's more than one, all of them must be in good standing with IBLCE. Now, for those who choose this pathway, they must have their program pre-approved by IBLCE before beginning to collect their clinical hours. So just a quick note, for those of you who may have breastfed or chest fed or provided human milk for your baby, the hours you spent nursing and pumping and helping your friends doesn't count towards your clinical hours. Now, while 500 or 1,000 hours seems like a lot, there's a good reason why. Each candidate needs to have the clinical experience so they can provide competent care as an IBCLC. And as Sekeita alluded to before, every single day, every single week, every single year, we learn something new. So candidates who are applying for the IBLCE exam through Pathway 1 need at least 1,000 hours, right? So for that candidate who is also a healthcare provider, the hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBLCE recognized organization like LER, their hours can be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. The hours need to be counted on an hour-by-hour basis. So now 2 important points about the clinical hours. One is that it's important for you to document them as you accrue them. Be very detailed in case IBLCE chooses to audit your application to take the exam. They may want to see documentation such as a spreadsheet or some other document where you counted your hours. And 2, the 1,000 hours do not need to be directly supervised. So note that LER has a program for those of you who are not already affiliated with a breastfeeding support organization. Certified breastfeeding specialists, which is our credential for supporting the normal course of breastfeeding, CBSs can apply to become a part of the hours program. And this program is a way to offer, it's a way that we offer for you to accrue those 1,000 hours. So being a CBS and being part of our hours program is a way for you to collect your 1,000 hours. Now, Pathway 3, that one requires 500 hours of clinical experience. It's best done in a busy practice setting where you can work with many breastfeeding, chest feeding families or those providing human milk for their babies every day, such as in a hospital or a clinic setting. The hours count towards the 500 only when you're actually working with families. Observation hours do not count. Now remember that clinical experience is graduated, meaning that it starts with observation, then doing tasks under supervision, then completing tasks independently with the IBCLC nearby to ask questions. LER has an internship program as well, with many sites around the US. Reach out to support at lactationtraining.com, and we can connect you with our clinical internship director to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate an internship site. Now, one thing Amy wanted me to mention in this webinar is that you can't start to count your hours towards the internship requirement until both you and the IBCLC are comfortable with you working independently. Now, most interns are going to spend about 75 hours in orientation before you can begin to accrue the 500 hours. So it's important to budget for that when you're thinking of your time. Or you can take a look in your community to see if you can find a willing internship site or mentors. You may need to reach out to many people to talk with someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk to others who've been through Pathway 3 to find successful strategies with finding a good mentor. Now, while this pathway takes an additional step or two, some people will ask, is it worth it? And I say it is worth it if you can find a Pathway 3 internship. And the reason why is because IBCLC reports that students who come through Pathway 3 score best on the exam. And I think it's that mentorship which is really the key component. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway if this is possible for you. Now, a lot of people are asking whether or not they can accrue clinical hours via telehealth during the pandemic. I just saw a question in the chat. So the quick answer is yes. Now, the longer answer is paraphrased from IBCLC documents. IBCLC will allow the use of technology if certain parameters are met. You'll need to pay attention to privacy rules and the Code of Professional Conduct and the clinical competencies for IBCLCs in order to use telehealth as a way to gather your hours. Now at LER, we have two ways to gather your lactation-specific education. One is LCTP, which is our Lactation Consultant Training Program. It is the full 95 hours front to back. And the other one is either our core or bridge course. They're designed to meet your education needs depending on your background and your previous lactation training. So first, the comprehensive course is LCTP. It's 90+ hours, which is eligible for CERPS, CME, and nursing contact hours. It's intended for those who do not have any lactation education and they know they want to become an IBCLC. It's also for those who may have taken lactation training in the past and now you decide you would like to become an IBCLC. Our course is up to date and it has more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices such as your computer, a tablet, or phone. They're optimized for a computer, but they can be reviewed later when you're on the go. Now, we've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we'll update sooner as new evidence emerges. Have a question for the instructor? You can send an email to our support forum, and we have IBCLCs available to answer your questions. Now, upon completion of the 95-hour course, you are eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you're a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With the CBS certification, you can begin to collect your clinical hours towards the IBCLC exam through our hours program. Now, if you're not sure where to start or you already have some lactation-specific education hours, then we have our core and bridge programs to meet your needs. They have the same advantages as LCTP. Our initial course is called Core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's 52+ hours of online education. It covers the basics, such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course, you can also take the Certified Breastfeeding Specialist exam. Now, the bridge course is ideal for people who have the basic lactation education components, and they need that extra 45 hours to qualify for the exam. Now, topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. Not sure where to start? Well, if you're new to the profession, I would suggest the core course. Check it out and see if it's something which fits your lifestyle and your world. and if it's something that just makes you happy. Now, I know that these requirements may seem like a lot, and just to review, we are here every step of the way. If you have questions about the pathways that don't get answered here today, please be sure to reach out to our friendly customer support staff. Many of our team are IBCLCs, and they know the process inside and out. We have 3 ways for you to earn your education, depending on your goals and where you are right now in the process. If you have questions about which would be right for you, again, reach out to our customer support team. They're here to help. Now, if you're not a health professional already, working directly with mothers and babies, getting those hours can feel like a challenge. We have 2 programs, one for Pathway 1, our hours program, and one for Pathway 3 students. Now, when you're ready to take the test, LER has you covered for the IBCLC exam. We offer 2 versions of our very popular exam prep course. Both use our LER QBank system, which is a comprehensive database which includes practice exams, photo flashcards, anatomy flashcards, a study schedule, and more. For those who take our 95-hour course, we include a discount to our exam prep course. Now, our 90 hours as well as the core and bridge courses are available in Spanish. Capacitación en Lactancia is our website which provides the same high-quality education found on LER in Spanish. Now, at LER, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of our commitment to increasing access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. Now, in alignment with our continued commitment to diversity, we are proud to announce our Rising Tide Lactation Equity Scholarship Program, which is designed to increase the number of Black and Latinx and Hispanic IBCLCs in the United States. We recognize one of the greatest obstacles to entry into the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for Rising Tide Scholarship awardees. And we alternate these scholarships each year. In 2025, we will host our Juntos Triunfamos Scholarship. You can find out more information on our website, lactationtraining.com/Rising Tide. Our team is here to help you now and in the future. We have tech support open 7 days a week. You can get your questions answered by experts in the field and ongoing support for the next steps in your lactation career. So we are here to support your journey. And now, what are some of the questions that you have for us today? Sekeita, are you here? As I pull up the questions. Oh, someone is asking a question here. If you're accepted in the hours program, do you have support and advice in helping us set up our own private practice? Yes, we do. And we have a lesson on starting your own private practice. And we also have a lesson on anatomy of a lactation consultation. So what it means to actually do a lactation consultation. So there you go.
There's another question. I'm looking for Pathway 3 mentorship, and I've noticed lots of people are looking for an RN that is also an IBCLC. Is it hard to find a job as just an IBCLC? Wow. Okay, so I'm gonna unpack it for just a standpoint is that you don't have to look for an RN that is also an IBCLC for Pathway 3. An IBCLC is a standalone credential. Is it hard to find a job? Geographically speaking, there may be some areas and some hospital settings or systems that will put that as a requirement of the position. However, I know many IBCLCs that work in hospital settings that are not RNs that are IBCLCs. And I like that. I would never say they're just an IBCLC. I would say they're an IBCLC because you work so hard. You get the clinical hours, you do the college courses, and it is a profession. And so Angela, I saw you pointing and I
I was
want you,
being goofy. Yes.
but I want you to jump in and just share the number of IBCLCs we have that are that don't have an RN license, that actually work in hospitals.
So it goes back to those questions that Sekeita was talking about in the beginning. And so find out in your community, what does the job market look like for people who are IBCLCs, who work standalone as that IBCLC. And indeed, in my area, which is the Washington, D.C. metropolitan area, we do. There are many hospitals where I can get a job, and that's where I worked for almost 20 years. So indeed, doing the private practice as well as working in a hospital is something that you can do. And so ask those questions before you dive in with both feet.
And the other thing I want to unpack is about finding a mentor. One of the things I always recommend for people to do is to actually start to center yourself in circles. Well, not center yourself, but start to go into like breastfeeding coalitions, even local events that have lactation, that's lactation focused. Start to network and then start to relationship build. I will say this, it's very challenging because when I ask the question, like, is your area saturated? Most areas are not saturated. And most IBCLCs, they are kind of stretched thin a little bit with trying to meet the needs of their community, right? And so really and truly having to train someone or to really get them up to par where they're getting clinical hours, that requires some time and some energy. And I will say from a standpoint of having done this, you really want to know that the people that you're bringing along are serious, that they're self-sufficient, that they're proactive, that they understand the importance of the role that we play in families' lives, right? And so a lot of that is building relationship with people. Sometimes people just won't say yes to, just like, I don't even know you, but I'm going to mentor you, right? But when you take the time to cultivate relationships and really to be transparent about what you're hoping to achieve at the end of that relationship, I think mentorship, like a lot of people have, I read an email, for example, I'll give you this example. I was saying no to everyone because I just didn't have the time, right? I didn't have the time. And this one person sent me this compelling, heartfelt email. And I was like, I can't say no. I gotta make time. I mean, whoa. It blew me away. But I did bring in some other colleagues to help with this mentorship. But I'm saying that to say, build relationships. Finding a mentor is challenging, but you also do want to find a mentor that's also right for you, right? You want to find that perfect fit. So I hope that helps.
Right. And so I'm just looking in the chat. There's a bunch of questions, Sekeita. So apologize for my distractedness. And indeed, you do have to ask a lot of people. You may have to ask a lot of people for those, internship hours, and you do want a good fit. You do want to make sure that you have that good fit. Someone is asking about our Walden courses and whether or not you can take them if you're in New York. And I've actually been chatting with Walden about this because theirs is with the School of Lifelong Learning. And so there may be something which is slightly different. I highly recommend that you reach out to Walden, go through our link on our website and reach out to Walden and ask them that question specifically. They've got some really good customer support people who can answer that question, because I think that the answer to that may be changing. So do reach out to Walden and ask.
There's another question, and I'm loving this question because I'm biased, but anyways, is there another pathway for nurses who want to learn more and possibly consider a certification versus the 3 pathways you discussed? Well, consider a certification. The certification is the ultimate, I guess. Well, IBCLC is what we're talking about, right? But there are certifications like the CBS certification, the Certified Breastfeeding Specialist certification. So if you want to learn more to be able to assist, for example, with your everyday workflow, the CBS certification is a great start. Absolutely. There is the question, how do I submit my hours for Pathway 1 if I'm an L&D nurse? The IBCLC, they do have a calculator. They do have the form where you submit your hours on and you collect your hours. Be real careful with that. I bring you greetings as a former labor and delivery nurse, and you could only use so many hours. I did not use Pathway 1. I used Pathway 3 because I wanted a more clinical foundational knowledge. I wanted to be able to follow along another IBCLC. I wanted to be able to have more experience. And as an L&D nurse, I knew that the most experience that I was getting is maybe an hour, if that, after every delivery, and not even an hour after every delivery, because not all babies will latch at that time. So it's very important to understand that you can only count your time as assisting with the actual lactation support. You cannot count your time as a L&D nurse. You can't count it like that. And so, yeah, you may want to go to IBCLC's website and really check that out for yourself.
Yeah, download the calculator now, and then that way you'll have an idea what you need to show in order to to demonstrate that you've got the hours. Someone is asking, can you sign up for the 95-hour course, then take the CBS exam once you've reached 52 hours? No, the CBS exam is either at the end of the 95-hour course or at the end of the 52-plus-hour course. So you'll need to take that specific course in order to take the exam. And the reason why is because the education that you have, the 95 hours isn't exactly broken down into 2 separate courses. And so that's why you need to, the full 95 hours, we've really intentionally created it to ensure that it covers all aspects of the detailed content outline. But not every CBS who takes a 52-hour course wants to be an IBCLC. And so that's the reason why there's the difference between those two.
Yeah.
A lot of people are asking for the Pathway 3 information. Then so Julie has put interns at support at lactationtraining.com. Support at lactationtraining.com. Just reach out to our general support and they'll forward it to Amy.
Yeah. There's a comment, a lot of mentors surrounding me have no desire to mentor someone who wants to open up a private practice. Oh, that's heavy, because there's 2 things at play. There's mentoring for clinical and there's mentoring for building a business. And a lot of times building a business and helping someone with a business plan, that's really not mentorship, that's consulting. That is, you want me to help and that's a total different focus. So I do get that. Like, I would say that opening up a private practice is a lot of hand holding, there's a lot of sometimes crying, sometimes you need a lot more, right? But if that IBCLC's focus is families and a clinical component, yeah, that may be a full stop for them, because that's primarily what we do and what we're charged to do is to support families, not necessarily to kind of help a person build their business, so to speak.
Right, it's a totally different thing. Building your business it's a business thing. It's not necessarily a clinical thing. So yeah.
Yeah. How do you verify the courses? I would like to learn a little bit more about what that is asking, a little bit more specific details if possible.
Verify courses? Are they wondering, you mean the college courses?
Yeah, I don't know what that means. There's another question that says, can pathways be combined? Can I be in your hours program as a CBS and work alongside an IBCLC for Pathway 3? Woohoo, Angela.
Yeah, no, it would be nice if you could do that and really be gathering a lot of hours, but no, it's IBCLC. This is an IBCLC requirement. It's not an LAR requirement. They want you to pick a pathway and stick with it.
This question, is it difficult to become an approved breastfeeding support organization if you own your own CLC business? That question would probably go to IBCLC, because they are the people who you would have to write up a whole host of things to become a breastfeeding support organization. And there are certain requirements and criteria that you must meet in order to become one.
It's a lot of work.
Yeah. What are the main difference between an IBCLC and CBS in regards to what you can do with each certification? Great question, Angela. You want to start with this one?
So generally, it's the IBCLC is the gold standard. The IBCLC is the one that can handle all levels of lactation acuity. All those complicated cases that Sekeita was talking about, that needs an IBCLC. Someone who is a CBS is someone who is supporting people who are through the journey of, let's just say, the normal course of breastfeeding. And what we mean by that is we are talking about things which are relatively uncomplicated. And the article Sekeita was referring to is from, was updated recently, I think in 2024 by Rebecca Mannel, which talks about lactation acuity. And so what some of the basic things are versus what some of the complicated things are. I think that it may be good to take a look at that article. You can also take a look at the scope of practices for the two different credentials and sort of compare the two yourself. And so I think it just really depends upon your practice setting, what your goals are, and what your plan is once you actually receive either certification. What many people will do is they get their CBS, they do the 95 hours, get their CBS, apply to our hours program, and then start to gather clinical hours. And for the people, for example, who say, well, can I join the hours program, or can they do it a different way? Meaning, can they start helping people then do the education? Well, the thing with that is that, let's say, for example, in my community, the best way to get more milk to a baby is to have the parent stand on their head in order to increase the amount of volume that the baby gets. And everybody in that community knows that, but yet the science may not necessarily say that that's what you do in order to get more milk to a baby, right? So you want to make sure that you're providing the evidence-informed information in order to A, support families, but B, pass the IBCLC exam. So anything else you want to add to that, Sekeita?
No. There was clarification to that question about verifying the courses, and it's the college courses. So how do you verify the college courses? You would submit a transcript, just making sure that your science courses match exactly what IBCLC is asking for, the 14 health sciences courses.
You mean submit to IBCLC?
Yeah, verification.
They don't do that anymore.
Oh. So what?
So that's why you have to take a look at those broad terms and see if it fits, see if in your mind it fits.
Okay, learn something new every day.
I know. They did used to do that, Sekeita, back in the day, yeah. and we would have to pay money in order to get that approved, but yeah, they don't do that anymore.
A long time ago, huh? Okay, Angela, what are you saying about me? But anyway.
I don't know about long. I wouldn't say long.
All right, no. There is some clarification. The reasoning is competition as far as knowing you wish to own a practice. They don't have the desire to help, knowing you plan to not stay with them long term, if that makes sense. That makes sense, and it makes me sad. There's a term that I love that I adopted and picked up. I believe the first person I heard say it was Felicia Floyd, and she says, community over competition. And as I said, there is no community that's saturated. Most communities are in dire need of lactation supporters who really are clinically sound and are able to assist in most of the higher acuity cases. And so that does make me sad, but I understand it, but I'm like, okay.
Yeah, I know some people say you don't want to train your competition, and yet I think there are plenty of families for all of us. So, yes. Yeah. And some people may resonate with Sekeita and they don't resonate with me, and vice versa, right? If we were in the same community. So that's something which is important to be mindful of. So what else do you see here?
There's just asking help for location regarding the hours program. I think I may miss the 95 hours is within the core and hours program.
No.
95, right, go ahead, Angela.
Sorry. So the 95 hours is the lactation consultant training program. At the end of it is the certified breastfeeding specialist exam. The core is a part of the hours, is 52 hours of the 95 hours. So it's just a piece of it. So you can either do If you know you want to be an IBCLC, then I would say do the 95 hours LCTP and then enroll in the 95 hours LCTP and then enroll in the hours program. If you want to sort of like test it out and see, then do the 52 hours CBS and enroll in the hours program. Either way, pathway 1 through LER, you need to be a CBS and you need to apply to the hours program.
Yeah. Yeah, thank you. It is sad. And yes, seeking business mentorship is awesome, particularly if you know you are going into private practice. I always tell people do the both and if you can. So you're getting your clinical hours and you like toward the tail end and you know that you're getting ready and you want to start a private practice, is to begin to think about developing the tools and all the other extra things that you need to be able to do so. And so, yes, I agree with you.
Me too. Okay, I think we have all the questions for now, right?
Yes, it's been an engaging group. Let me just make sure I'm going back to the flag. Yes, I think we do. We did answer most of the questions.
Oh, wait a minute. Nope, there was one I missed. One second.
Oh, there's another one.
Yeah, there was one.
IBCLC diagnose oral ties. Okay, if you are a licensed healthcare provider, that it is within your scope of practice to diagnose, and you are an IBCLC, then you can diagnose ties. If you are not a licensed provider that with the ability to diagnose, that's within your scope of practice, then you cannot diagnose oral ties.
Yes, and an IBCLC does not diagnose an oral tie. An IBCLC describes what they observe and the impact to the breastfeeding relationship to someone who is able to provide the diagnosis.
Yes.
And so that is to be very clear about that.
Yes. And even as when I was an RN and an IBCLC, I could not diagnose. And that was why I'm like, I need to become a nurse practitioner.
Exactly.
Because I want to be one-stop shopping. I don't want to be bound because you see me as a lactation consultant and I got to send you to somebody else, even for them to diagnose, and then they have to send you to someone else to even correct it if need to be. Like, that was a lot. That's a lot for new families, right? And so that's a great question.
Yeah, it is a great question. And as someone who did that, you know, I have really great relationships with different providers in my community, pediatric providers, obstetric providers, tongue tie, you know, dentists, ENTs, you know, I just have relationships with people so that I can, you know, when I describe something or I'm using a tool, a validated tool to talk about what the impact is on the frenulum on the rest of the mouth and mobility and everything else, I'm able to refer to that. So I did find this other question here. Am I eligible to apply? So it is April now that we're recording this. Am I eligible to apply for the September exam if I haven't yet completed the 95-hour education requirement, but plan to enroll in and complete an approved course by then? Do you know the answer? Do you want to answer that one, Sekeita, or do you want me to?
I was reading something else, Angela.
So I'll go ahead. So the 95 hours, so it will take you 95 hours to finish, more than 95 hours to finish this course. And you need to be done with the 95 hours by the time you need to be done with all of your components. So the college courses, the 95 hours of didactic lactation education, and your clinical hours, and the college courses all need to be done before you apply for the exam. And the application window for the IBCLC exam will probably open sometime in mid-May. Do not hold me to that because that is not something that I control. It is something that IBLCE decides. Therefore, you have to apply to take the exam several months prior to actually taking the exam. So you have to apply in around mid-May, so everything needs to be done by mid-May, and then you study from May to September. Hopefully that helps.
Yes. There's another question. What additional certifications would be beneficial to complement your IBCLC credential and enhance your employability? and versatility. For instance, a Lamaze certified childbirth educator. That's great if you are going to do private practice, the more versatile you're going to be. But you're talking about employability. A lot of times when that could help, I mean, it's a benefit. But a lot of times when folks are seeking lactation or an IBCLC, they really are making sure that you have the credentials and qualifications to meet that position requirements.
Mm-hmm. Next question. I finished my CBS certification, I'm assuming the 52 hours with LER, and have not completed the clinical hours required to take the exam. Does LER offer a bridge class so I don't have to retake the 95-hour course? So we have a bridge class, which is 45 hours. And so it depends on when you finished your 95-hour course. If you took 95 or 54. So I'm not sure if you took the 95 hours or the 52-hour course. But indeed, we do have a bridge course for people who do have some lactation education, 50 hours of lactation education, and you want to take the rest to become an IBCLC. If you have already taken the 95 hours and you need to prepare for the exam, our exam review program, the full one, is actually something that you might appreciate. So there we go.
There's a question. Essentially, could a CLC refer out as well when noticing tongue-tie issues, just like an IBCLC? Since we too do not diagnose, we simply refer, especially if taking TOTS additional training. Dentists locally only care that as a lactation consultant, we feel comfortable and confident with care afterwards for a family. But is this against our scope? Or if we've taken the training, it's fine. I'm going to say that I don't know the scope of practice for a CLC. I'm going to say that that's a loaded question. You can always refer and describe what you see. The person who does the diagnoses is the actual licensed clinician that's able to do so. I will say that the AAP has a new publication and statement on the clinical management of ties, and the language has changed to what they say are symptomatic ties. And so there's lots that's coming. There's more research that's coming. I am very clear, even as a nurse practitioner, let me be very, very, very blunt. I am still hesitant to really diagnose, simply diagnose.
Yep.
When it comes to ties, because there's a lot of stuff happening. And so I don't even like to even have this conversation like really live, because when I say a lot of stuff has happened, families have been harmed, but on the other side, families are caught in between some clinicians who don't even believe in ties. It's like, wait, you don't believe in it? It's right here, right? So there's a lot going on to these questions, more to come, more to unpack. But I leave the actual, I believe it's a collaborative, multidisciplinary approach. You always need a feeding specialist and a person who can manage lactation, all of the things. Like, you need a collaborative approach. You need your body worker approach. You need all of it. And it's complicated.
It is, and yeah, it is. And it also, part of the question has to do with the referring provider feeling comfortable with your care to provide that follow-up support. And so really, is it you who's providing that and the additional training you may have, or is it the provider, right? Because every provider has different follow-up with regards to aftercare. Some do, some don't. Some are really specific and others are not. And so there is emerging research on this topic. There are several national and international organizations who are providing the research and the guidance for this. And it's important that you are, following that and or ensuring that you're staying within the scope of practice of whatever certification you have. So that is something which you need to be very clear about and make sure that you're representing yourself accurately.
Oh, that last sentence. Thank you, Angela. Oh, Once you finish
Absolutely.
the CBS course, would you recommend trying to find a place to do hands-on clinical, or do you wait once you go for your IBCLC? Why wait? Why wait? Once you do your CBS course, the more clinical skills you can develop and have assures that once you take the IBCLC exam and you pass, you are ready, right? Why wait? That's my feedback.
I like that. That's good. Excellent. Well, this has been a very fun webinar today. Thank you. See, we really are doing this live, and we're here even when the cameras go off. So please do reach out to us if you have any other questions, support@lactationtraining.com.
Yes, thank you. Enjoy the rest of your day. Bye-bye.
Bye-bye.